Okay, before I start with the presentation, I'd like to introduce myself. I'm Sasha from Botiss, working now in Botiss for more than 7 years as a product manager. Was recently involved in the launch of our latest baby in the portfolio, Plus, and this is going to be the topic of today's webinar. I will share my presentation and then we can go through it and discuss the most important points. See the full screen and you see the slides moving?
Yes.
All right. Okay. So I'd like to show you the properties of this new product. Would like to highlight what is so unique about it, and especially in comparison to the usual particulate bone grafting materials we know in the market. And so I structured the presentation in the properties of this product, especially how it is prepared, because there's a slight difference from the normal particulate grafting materials. I'd like to show some clinical use, some preliminary data from studies, and in the end, also some results from the limited market release we performed last year. So Cerabone Plus is a combination of Cerabone granules and hyaluronate. And so the product is actually an add-on of our most successful material, Cerabone. And before I go into detail of the Cerabone Plus, I'd like to put a few words on Cerabone. Some of the properties of this material are already listed here, but I again would like to show you what we have reached with Cerabone and what is so special about this before I talk about Cerabone Plus. So the Cerabone, which is the base product of Cerabone Plus, is in the market for more than 15 years now, and it actually started in the orthopedics field. And later on in 2006, it was registered in dentistry. I think not many people know this. So it has already a history in other medical applications, and a successful one, of course. And only in dentistry since 2006, we treated successfully more than 2 million patients worldwide. As you know, Botiss is structured worldwide with a network of different distribution partners, including Grega, of course, and is sold in more than 100 countries. And since then, of course, scientific and clinical literature accumulated over the product, and we can rely on more than 200 publications so far about Cerabone. This product is produced from the femoral heads of cows, so I think you're familiar with it. It's bovine bone. However, the production is quite different from what is done with the market leader product. I think you know it, because here we go with very high temperature. So the femoral heads we use will be processed with more than 1000 degrees Celsius, and actually we only use natural ingredients. So it sounds very simple. So we apply heat and rigorously rinse and clean. However, it's not a burning, just a pure burning of the bone. It's rather a sophisticated and sustained heating. And this way we create pure bone mineral. So the data on the material and the material characteristics show that this material, Cerabone, is pure bone mineral. So there's no other remnants present. And you can imagine that applying such a high temperature, all organic components are removed. And in addition, other materials found in the inorganic phase, so like calcium carbonate and also water remnants, are also removed. So we create a highly crystalline material. And this way it is absolutely stable. So once placed in the defect site, osteoclasts are not able to resorb or to engulf this material, at least completely. So we talk about an only superficial degradation. So this high temperature not only guarantees a maximum safety, because we can also of course, eliminate everything potential infectious, even the prines, the infectious agents of the mad cow disease. But in the end, with this high temperature, we also generate a pure bone mineral with a maximum and a very high volume stability. There's one evidence in the literature showing that this product performs indeed different from the market leader product, from the market leader bovine bone. Here, 4 years in sinus flow augmentation, these authors could show that Cerabone has substantially less volumetric loss over time than the market leader product. Coming back to Cerabone Plus, so we rely basically on all the nice properties of Cerabone with this material. However, we add now hyaluronate, and of course, this sounds very, I think, appealing, and given that there are so many functions on hyaluronate. And hyaluronic acid has a multitude of activities in our body. This includes biological activities, but also kind of structural space-occupying functions. There is many published about this biopolymer. What is well described is the stimulation of blood vessels. So once you put hyaluronic acid into a wound, it boosts vascularization and this way promotes wound repair. On the other hand, it has also activities on many regenerative cell types, including fibroblasts, and there's also a debate ongoing on its function on osteoblasts, on pre-osteoblasts in terms of promoting mineralization of tissues. Another interesting feature of this product, of this biomolecule, is its exceptional liquid binding capacity. So once it comes into contact with liquids, it takes up the liquid and it retains it. So it kind of jellifies. I found one number here in the literature saying that one single molecule of hyaluronate can bind up to 1,000 times more of liquid. So it is a hugely hygroscopic, it is called. There's actually no other biopolymer in nature which has such a high binding capacity of liquids. And this is actually what we make use of when it comes to Cerabone Plus. This I show you in the next slides. Again, a few other words to hyaluronic acid. It has several configurations, let's say this way in the body. So there is high molecular weight and low molecular weight molecules in the body found. It is, to a major extent, it has structural supporting functions. So it serves as a lubricant or even as a shock absorber in many tissues. And this way, it's an important molecule of our extracellular matrix. And nonetheless, to say that it's also found in alveolar bone and the gingiva. In medicine, it has been used for decades, including not only dentistry, but also other fields like orthopedics, treating chronic diseases, even ophthalmology. It is used, if you remember, the eye drops. All right, and interestingly, in dentistry, there is not so much described in terms of bone grafting and implantology. So there's a lot of literature found for the treatment of periodontal diseases. You may know a treating of interdental papilla loss is very popular using hyaluronic acid, and treating like chronic inflammatory diseases around natural teeth. But in terms of dental implants and even bone grafting, there is less published so far, and this way Cerabone Plus is even more interesting, considering what is found actually in the literature on bone grafting materials with hyaluronate. So for Cerabone Plus, we combine these characteristics of Cerabone with the properties of hyaluronic acid, and specifically we take advantage of the liquid binding capacities of this hyaluronate. So once Cerabone Plus comes in contact with liquid, once it is hydrated, the hyaluronate takes up the liquid and it jellifies, and it leads to particles, to the Cerabone particles being bound in a connected mass. And this way we create a sticky bone, which provides a great application comfort. Cerabone Plus comes dry in a blister. The product has to be hydrated before. You see here in the picture how it looks like. So the granules are surrounded by hyaluronate powder. This is actually a salt form, a water-soluble salt form of hyaluronic acid called sodium hyaluronate. And this is how it comes. And the blister has been chosen for the dentist to conveniently hydrate the product. So you do not need to put it into a dip and dash or anything else. So you just open the blister, the inner blister, so it comes in a double blister. You open the blister and you can directly hydrate it there. One word for the hyaluronate we use for the production for Cerabone Plus. This is manufactured biotechnologically by bacteria. So we talk about fermentation. Actually, this way it's a non-animal origin. You can compare it to the production of insulin, for instance. Very important is the preparation of the product. So it's different from usual particulate grafting material, because for usual particulate grafts, you actually do not necessarily have to hydrate it before you use it. For instance, for Cerabone, we actually recommend it, but it's not mandatory. However, for Cerabone Plus, it's a requirement. So it has to be hydrated before to reach the sticky bone. And here we validated a hydration protocol. So roughly you can keep in mind half of the liquid of the actual product you have to add. So for instance, for 1 ml, 1 cc of Cerabone Plus, you have to add 0.5 ml of, for instance, saline solution, patient blood, liquid antibiotics, Emdogain, or even PRF or PRP. It doesn't matter which liquid you use for hydration of your grafts. You can use any year for the hydration of Cerabone Plus. And in this video, you see actually how it works, how the process is. So you have a double blister, you open the inner blister, and you will see the granules together with the hyaluronate. You add the certain amount of liquid. So it's, for instance, for the 0.5 ml, it's roughly 10 to 12 drops. And you have to mix it properly. So this takes a couple of seconds. You will realize that the hyaluronate takes up the liquid, that it starts to gellify, and you create this kind of sticky material. So this way we create a quite nice handling experience, if you want to say so. It's quite different from what usual particulate grafting materials can actually achieve with. We have a material where the particles are being bound in this jellified layer of hyaluronate, and the particles are not kind of displaced during the application. You can easily put it on the spatula. You have a convenient transfer to the defect site, and in the end, you can even mold it at the site, so it's not hardening the product, and you can efficiently fill your bone defect with this material. So it offers a quite nice handling, and this is what dentists appreciate, what we so far heard from the limited market release. Since the material is kind of liquid sensitive because of these functions of hyaluronate, we have to take a bit care of the bone defect we are treating. So if you add more liquid than given in the protocol, or you have more liquid around in the bone defect, like in cases of profuse bleeding, it is advisable to reduce the too much liquid from the graft or either from the bone defect. So in other words, try to control the bleeding, try to control the amount of liquid at the defect side, and then you will have the stability as given here, or as shown in this picture, where you have the sticky bone even be possible to taken up with a tweezer. So then it's quite the optimal situation for this material. And nonetheless to say, as for all substitute materials, Cerabone Plus has to be covered with a membrane according to guided bone and tissue regeneration. We have the whole, let's say the whole portfolio of indications possible with this material. You can treat peri-implant bone defects, you can treat sinus elevations, periodontal bone defects, and even, of course, fresh extraction sites to build up new bone. Cerabone Plus is available in two particle sizes, as you are maybe familiar with the Cerabone. So we have the small and the large granules, and both particle sizes come in two volumes. Currently, we have only available the 1 ml. However, the small volume will also be available soon. We have some preliminary results from research about this material. This is a publication from a German group from the University of Mainz. And they actually looked on the activity of human osteoclasts and compared it to Cerabone. And this way they tried to figure out what is actually the function of the hyaluronic acid in the Cerabone Plus. And what they found was a significantly higher activity of osteoclasts in presence of Cerabone Plus compared to Cerabone. So these cells showed higher viability, higher migratory activity, and in the end, they multiplied much more efficiently. So this seems from these preliminary results that Cerabone Plus exerts a certain activity on such regenerative cells. And it's quite interesting how the authors concluded that the biofunctionalization of the normal Cerabone with hyaluronate seems to improve osteoclast activity. So it's kind of, you take the normal Cerabone, you embed it in hyaluronate, and you get an increased activity and increased function on regeneration. Of course, we are now evaluating this on a clinical level in clinical studies, but no results from this so far. Some clinical application, a clinical view, how is it used, how does it look like in the defect? Here, a case of a peri-implantitis affected site treated with Cerabone Plus. In this case, the material was hydrated with liquid tetracycline. So it's also possible, as I mentioned before. And you see how nicely it adapts to the defect and how less particles you have actually around. So you have a good adaptation here to this exposed implant threads. The dentist used laser membrane to immobilize it, so tightly adapted. You see fixated with pins. Wound closure, and on the right side you have the 6-month follow-up. The case is still ongoing, so this is the last picture of this. Another one in immediate implant placement, I think also a nice indication for such a material to efficiently fill the peri-implant gaps. So in this case, the tooth was extracted and an implant was placed right away. You see on the upper right-handed picture, JSON membrane placed on the buccal side due to the buccal bone missing. And then it was grafted with Cerabone Plus. On the left-handed side lower picture, you see how nicely it is to be able to be transferred. At the defect side, you have one particle mass, which offers a convenient transfer of it to the defect. And as well around the implant on the middle picture, lower row, how well it is actually, looks like around this placed implant, how well it is distributed, and again, not much particle around. This case is also ready, completed, In this case, the dentist re-entered for implant uncovering 3 months after implant placement. You see some Cerabone granules here still present. That's the usual re-entry picture, the usual lookalike. As I said, Cerabone does not resorb, however, it is integrated into the newly formed bone. And then you see the final result here in the lower row and even a radiograph in the end. Again, you see in the radiograph the radio opacity of Cerabone. There is still granules present, and that's the usual, the usual picture of integrated Cerabone particles. Another case shown in a surgery, I'd like to demonstrate you. Here, peri-implant bone augmentation was performed on a missing tooth or in a dental site in the posterior maxilla. And the dentist decided to treat this defect with Cerabone plus, actually with autogenous bone, with Cerabone plus and with Jason membrane, so for a guided bone regeneration procedure. So once the defect was prepared, you see the missing horizontal bone volume. Actually, in vertical dimension, there is still enough bone. And then, the implant bed was prepared and the bone level implant was placed. And there's still some threads exposed. And the threads and the missing bone volume was then augmented with Cerabone plus. Before the site was grafted, Jason membrane was inserted, fixated with titanium pins. And as said before, here in this case, the dentist used kind of a sandwich technique, placing some of the autogenous bone on the threads. And Cerabone plus was hydrated as I tried to explain to you according to the hydration protocol. So you need to just a short mixing of the product, and you soon will realize how the hyaluronate takes up the liquid, and you will have this sticky material ready in a couple of seconds. And once you can take it up with not only with a spatula but also with a forceps, it has the right, it has just the right handling. And this is how it looks like. And you easily can transfer it to the side. And I think I do not have to put more words here. It's absolutely beautiful how you could replace it. Only a few granules around the defect. So very convenient to use. And then, of course, Jason membrane was placed over the graft, tightly adapted. It's also quite nicely, the case also quite nicely demonstrates the properties of this membrane, the pericardial membrane, how well it adapts and how well you can play with it. It does not break, it has a high tear resistance. And here in this case, it looks like a bit like a sausage technique, like Ishtar and Urban is doing with BioGuide. And you see how nicely the graft is adapted and how it performs. So this case is still ongoing. 2 other ones here in periodontal treatment. You see this huge defect around this molar in the mandible. I think also for this kind of defects, it's absolutely beneficial to have a graft which sticks together. I can imagine in the posterior area, it's even more difficult to apply a grafting material really efficiently and quick. And so I think it's perfect for such situations. On the lower left-handed side, you see actually the hyaluronate on top of the grafting of the particles. This sparkling looks like this is due to the hyaluronate. In this case is also ongoing. You see here the 14 days follow-up. And on the right side, the the radiograph 3 months post-surgery. A last case, also treatment of an edental site here. You see some horizontal bone missing. However, it was possible to place an implant in with a primary stability, and then the site was augmented with Cerabone plus again. Still, it nicely demonstrates how Cerabone plus adapts to the site. A good filling, nice adaptation, no particles around again, and you can easily pull the membrane over it, stabilize suturing. And this is the 6-month re-entry. This is the typical re-entry picture. Again, you see Cerabone granules around as they integrate into the forming bone, but not are being resolved. Finally, this is the last section of the presentation. I'd like to give you some insights into our limited market release we performed since the CE certification of this material. We actually performed this release in 20 countries, and we asked clinicians to give their feedback on the product and on the clinical performance, actually. And one point we asked was, how would you rate actually the application of the material? How would you rate it to your conventional particulate grafting material? And you see that the vast majority of these users rated the application up to 80% as easier or much easier. And this actually confirmed what we are now claiming for this material and what I have demonstrated with the cases I've showed you. Another important aspect was for us was how performs it in terms of soft tissue healing, in terms of wound healing, in terms of patient response. So we also asked the clinicians, how would you rate the very early healing around Cerabone plus treated sites? And they could rate it from 1 to 10, so on a scale. And as you see, they rated it almost 9. So clinicians were also very satisfied with the soft tissue healing. And considering this, that hyaluronate has such a huge potential on wound repair, it just confirms what is actually described about hyaluronate in the literature. And of course, it's absolutely nice if the grafting materials potentially give some additional boost on not only bone healing, but also on wound healing. And last not least, we were asking the clinicians, what would you say about the patient response? So have you observed a quicker patient recovery, less pain, less swelling, less use of analgesics, or how would you rate that? And you see here was not 50%, but almost every second clinician confirmed and said, indeed, I see an effect. I see an effect compared to my usual grafting procedures with Cerabone Plus. So with this final slide, I'd like to close my presentation. And of course, I'm open for questions.